difficult for me to actually even go back on that Facebook page because those people who are suffering, I just think, I don't want to go back there emotionally. It's so hard to think, because I was in a dark place. I was preparing to check out, but when you get that diagnosis and all of a sudden, anything that you thought you might want to do in the future, my kids were, I got the diagnosis at a time when my kids were mostly grown, and I was sort of thinking like, wow, it's kind of like chapter 2. I had one more kid at home, but I thought, but you get a diagnosis like that and you suffer a couple of those vertigo attacks and the ear noise is one thing, but those vertigo attacks are just so unpredictable and debilitating that you just think you can't even make plans.
Right.
What's the point? Do you know what I mean?
Exactly.
And so, because you think to yourself, and that woman who started that Facebook page, if you read her story, she had sort of slept off these vertigo attacks at in the bathroom at SeaWorld or something like that. It sucks.
Yeah.
Yeah. And so I feel for her. I've never really stared into that dark of a hole before in my life, and it was icky.
Yeah.
To say nothing,
Well, I similarly have gone and spent a lot of time away from my family and time away from the practice to spend time on some of these Facebook forums, especially with people living right here in Eugene. Like, dude, you don't got to fly anywhere. I think I can help you. And you can't get anybody to acknowledge that you know what you're talking about.
Right.
And I understand if you've tried a bunch of different things and there's a growing need of skepticism, but I had one of my buddies that's like, man, it's almost, and he does this too.
Mm-hmm.
He's like, it's almost as if they enjoy the suffering, or the attention. And I'm like, that's really not a fair assumption unless you've walked a mile in those shoes. But, if they're not ready, and maybe they know, maybe they've called, maybe they know what it costs, maybe they can't afford it, and so they're doing the best as they can to make things
Right.
as good as they can for them. But what I don't tolerate is people that say they don't have any idea what I'm talking about. I get that from more doctors than I do from patients. Patients are like, oh my God, if you think you can help me, I'm on board. I want to know what it is you know.
Exactly.
And doctors are more skeptical that correlation is not causation, and that's okay to say that. But okay, so you treat these patients? Oh no, I don't treat pain or dysfunction. I'm like, I understand that we need good evidence-based scientific research to back what we're doing. But there is a level of scientific inquiry when you're measuring every single time you do anything.
Well, that's what I was thinking too. I think to myself, it's not like you couldn't see the difference when my muscles relaxed. It was right up there on the screen.
Yeah.
You could see the difference in the pressure forces. You could thinking that's real data. Maybe it's not a double-blind trial or something like that. But I think to myself, I don't know. For this individual, it worked pretty well. I don't know what else to say. And if I hadn't come here either, I doubt. Here's the thing you don't know is where the next bit of information is going to come from. When you did that cone scan of my skull and my cervical spine, and you just happened to mention that my cervical spine was off center, I thought, that's kind of weird. And I started that's what led me to the upper cervical fellow that I went to go see. And I didn't know whether my upper cervix was off. I thought, the ear symptoms that I had were also things that, the C1 subluxation sufferers had too, and I thought I never would have pursued that if I, so maybe I would have, but that was kind of like, that was odd, and I and looking into that, and sure enough, my atlas, had been off for 40 years. And even if that wasn't part of the puzzle, I think to myself, well, it was affecting my spine and would have continued to affect my spine if I hadn't gone in and just, looked into the possibility that that was an issue too.
Yeah.
So,
hey, check this out. I've been told.
yeah.
I've seen it on an X-ray.
Yeah.
What do you think?
And by the same token, he took an X-ray of my spine. I was out of whack, and he measures me every time I go to make sure that my shoulders are level and that I'm square again. So, it's this, I don't know, to say, to not explore the option, to not give a patient, to not even mention that something has helped somebody else, and to say, who knows, we don't quite know what's going on, but why not just say, here's what I've heard. That person who's talked to you, to not share that information, I don't know. I tell everybody I meet now, I think if there's an issue, oh my gosh.
Well, it's funny because there's, and this is turning into just a very candid conversation between you and I, but I use Plato's allegory of the cave when I lecture. It's like, okay, well, we have one set of reality, and if you go out and step into the light of what's in the outside world, at first you're blinded by the light, and then you kind of accept that there are not just shades of gray, there's a blue sky, and there's warm running water, and the clouds are white, and the tulips are pink and yellow, and then if you go back into the cave and you tell all your fellow prisoners, hey, look, there's a whole other reality out there, and there's so much information that we don't have. You should come out with me. And they like, no, we want to stay right where we are because this is what we know. And Plato wrote the allegory of the cave 2,500 years ago because he was struggling with the same thing we're struggling with now as human beings. I know what I know, and I don't want to gamble or venture out that there's more information or data that I don't have. And so as a practitioner, that's a very scary thing because now you're starting to diagnose in the absence of data, and you can misdiagnose patients. And so while there's still no machine that can read pain or quantitate pain, there are still some things that we know that are not acceptable, like 30% of your entire bite force on one tooth. Okay, well, maybe this is going to help you, maybe it's not, but I know if I don't alleviate some of that pressure, you're going to end up with a root canal, you're going to chip the tooth, you're going to break the tooth's not going to be restorable, you're going to need an implant or have a missing tooth or a bridge. Well, isn't it easier to just adjust it a little bit than do all of that work? It's certainly more conservative.
Right.
Exactly.
That's the other thing. It's not even invasive. Like, I think to myself, you're not even risking anything. You're not even, as opposed to the surgeries, for example, that they recommend. I think to myself, it's such a benign, it feels benign to me. I don't know if it actually is, but the whole process felt so benign to me. Like, I thought, okay, no injections, no cutting open, no risk of infection. You know what I mean? Just, I thought, what's to lose?
Right.
What's to lose? So, I don't know. And, yeah, I don't understand the notion that, when somebody says they have Meniere's, I think, well, what does that mean? That's not like, I don't know, like, it's not a thing.
Yeah.
It's just a cluster of symptoms, and nobody knows why it's happening.
Right.
So that's not the same thing as saying, oh, I see a, tumor or something, or, your bone is broken, I can see it right here, we're going to do this. It's not a thing.
Yeah.
It's an absence of knowledge is what it was.
It's a black hole.
Yeah, it's a black hole.
Yeah. We can't see what's going on, but we can see what's going on around it.
Right.
It's a black hole.
Speculate it. Yeah.
So, it just is interesting because I'm gonna share this with my buddy Lane, and he's a very smart guy. He's a talented guy, and he teaches residents. But I have to chuckle a little bit, and right now he's probably, when he's watching this, he'll probably the eyebrows will be like, what is he gonna say? But for the people who say that there's really no science involved in this, or the people would say, well, Susan, you're just one person. And we would want we would prefer to have randomized control studies, and so would I.
You're right.
Of 500 people in the treated and non-treated, and the reality is we're probably not going to get that anymore because people are mobile and people are traveling and, people lose their jobs and people die and all that stuff. And I want to follow them for 25 years, not just 5 years. So I would say if you had a voice to any dentist who thinks that the technology has not served you or that the bite is not correlated to what your symptomology was, and not just dentists, I'm picking on a buddy, but even the ENTs or the general practitioners who think Meniere's, but not, maybe I should measure the bite and see if there's a bite force discrepancy on the affected side.
Okay, so I think about this past year a lot, just because the whole thing was so baffling to me, and it hit me out of the blue. And here's what I mean. I was fine my entire life. Fine, until the summer of 2015, okay? Which is when I had this sort of, I call it a cascade of symptoms, because the first thing I noticed was my ear was plugged up, and I thought, that's odd, my ear's kind of plugged up, that's weird, thinking it would go away. And then my ear, trying to unplug my ear, decongestants, was there wax in there, nothing was helping. Didn't make a dent, okay? Go to see the doctor. I have a small dizzy spell, nothing too terrible. Then I have another small dizzy spell. Now I'm hearing noises in my ear. I'm hearing distortion. I'm hearing noises seem very loud. I've lost a little bit of hearing in that ear when I go to the ENT. There's ringing. There's buzzing. There's really, really loud episodes where they woke me up out of a sound sleep. I call them foghorn episodes, where there was just this unbelievably loud noise in my ear, okay? So I go from being fine to my ears plugged up to now I've had a dizzy spell to now I'm having all these weird sounds in my ear. In other words, it's building, right? It's getting worse. It's not getting better. It's not stable. It's getting worse and worse and worse. Then I have another dizzy spell. Then I'm given this diagnosis of Meniere's, which, as we know, is a diagnosis of exclusion. It's not this, it's not that. Now we don't know, so we're going to call it this thing.
Sure.
Then I experience some vertigo. In other words, I'm a very compliant patient. If they tell me to take this pill, I take this pill. If they tell me to cut out sodium, I cut out sodium. So I'm doing all of the things that my ENT tells me to do. Not getting better, I'm getting worse. I'm having a vertigo episode. A couple of weeks go by, I have another one. Then a week goes by and I have another one. So it's not stable by any stretch of the imagination.
Yeah.
And the things that I try are not even stabilizing it. It's just this thing that's kind of now out of control. I come to see you, and I immediately have a stabilization after my very first visit. And first of all, the noises actually decrease in my ear after that very first visit. I've had no vertigo at all since seeing you that last time. And, the very first time in January. And ever since seeing you, and also seeing my chiropractor with the atlas adjustment, and my chiropractor knows that these two issues are related.
Yep.
My chiropractor knows that TMJ dysfunction and atlas subluxation, they're often related. And since January, not only have things stabilized, they've gotten better and better and better and better and better, to where I think to myself, is there still a little noise in my ear? Yes. Have I had any of those foghorn episodes? No. Does it continue to get less noticeable? Yeah, the whole thing is just one big long decrescendo in my ear, no more dizziness. I don't even have, I was an occasional migraine sufferer, no migraines. No, I don't know what proof you need. You know what I mean? Like, I think to myself, I don't know if my kid was suffering, I'd take my kid. Like, I wouldn't sit around and say, gee, I don't know what to do. I'd say.
Well, you did.
I did.
You did take your kid. Because you called me and you're like, hey, you said something about bone loss and recession, and my kid needs
He had a gum graft that failed.
He had a gum graft that failed.
That failed the day he came home from school. He goes to school in Ohio, and the graft went fine. It was looking good. He had gone back for a the follow-up for that thing. He's home 2 days. He wakes up one morning. The graft is completely gone. The root's exposed. The gum is just like it was before he went to have the gum graft. And I saw your friend I saw Sean Keller in Redmond, and he was hitting on that tooth. And Sean takes a little, I don't know how much, but even my son felt.
Like, my muscles relaxed. Yeah.
Exactly. And now he thinks his bite is off.
It probably is, because the muscles want to heal, and they want to go to wherever they can go to get relaxation and reach this occlusal homeostasis, which it's tough to achieve.
Right.
But and
the gum started to grow back.
Kidding.
No kidding. I mean, I don't know if it's back to normal, but we kept, so he was home. It was a year ago. Oh my God. No, it was over the summer, sorry. And the gum just, even Sean said, wow, it looks like that gum is growing back. So I haven't seen my son in a while, but he claims that he has no more trouble with it, and I'm going to see him on the 16th of December when he comes home. But I mean, so even that kind of a thing, forget the Meniere's, but he had this really pretty severe gum recession. He's a young kid. He's 23 or something.
Yeah,
and I think to myself, what the heck? And so...
And only in one tooth.
Only on one tooth,
yeah.
But the periodontist didn't say, oh, I think you're... I mean, the one dentist did say, I think you're grinding your teeth, but that wasn't really what he was doing either. He wasn't grinding. He just had this tooth that was hitting in this spot that he didn't even notice until,
The interesting thing is that a lot of patients, I can make changes, and tech scan will show me changes that patients cannot even perceive.
Right.
And so there are people that are going to watch this and was like, well, that's not me. And I guarantee you that if you were to measure and we were to put $50 on it, I'm going to win more than I'm going to lose.
Well, and I told you this before. I didn't think it was me either. I didn't think I had TMJ dysfunction. I didn't have any pain. I wasn't grinding my teeth. No dentist ever said, gee, you're grinding, or, nothing. Everything okay? Yep, everything seems fine. Because I'm not connecting my ear to my jaw. I'm not connecting noise.
Well, and
what have you got to lose?
Yeah, most of us don't, because we think that, a lot of what's going on is, muscles can deform and misshape bone, and a lot of those cranial bones in the skull are almost paper thin.
Right.
And so if you get a little edema, and the interior, not the exterior, but if you get a little edema on the inside of those areas, and you can see that, or effusions on an MRI, you can see swelling, or an egress of water to a location. That will affect how organs, vestibular cochlear organs in your case, can affect and react. And if you start deforming bone, even if it's just 1 degree, it's going to put pressure in a place that it's not supposed to put pressure. And it's only when you control the muscles and allow them to relax that you start getting this this homeostasis where you're supposed to be kind of feeling.
Right.
And I was trained that all these cranial bones are fused. Well, we've really only looked at skulls and cadavers, and so those aren't moving.
Right.
Much less a joint in the knee of a cadaver would be moving. But when you start to do something like chew a steak, I guarantee you they're moving, and we've got radiographic evidence that has that I just found with a doctor of osteopathic medicine, and a dentist looked at it, and then they've also measured it in other mammals like pigs. Just watch the bones move while they're chewing. So they do move.
Yeah.
And so if they move, and they move in a bad place, then you've got probably issues that you didn't even think that were associated with the bite.
Yeah, and the other thing about the Meniere's diagnosis is things like they don't, they ask about, for example, head trauma, and as a patient, when a doctor asked me about head trauma, I would think, have I had, recently? I'm thinking like in the last month or two, and I think to myself, the issues with my atlas didn't happen
Right.
in the last month or two. It happened 40 years ago. You know
Right.
what I mean? So I think to myself, even the questions they ask, they don't say ever. It's kind of this vague thing. I think, no, I don't remember hitting my head recently, or I haven't been in a car. You know what I mean? You
Sure.
think of trauma as something, first of all, recent, and that you would remember, as being traumatic. And I don't know.
Well, even going back to your undergrad, because I remember your story, you told me I had a wisdom tooth taken out, and then once that was taken out, it felt like my bite was off.
Well, and the whole thing started because I had my wisdom teeth taken out because I couldn't open my jaw anymore. Like, I would have to sort of manipulate my jaw manually to get it to unhinge. I remember this.
Sure.
Very strange. And then, you just don't, I guess I didn't think about it after that. My jaw was able to open and close, and then, gradually over time, I mean, I feel like, and you explained it to me one time when I said, why would this happen sort of all of a sudden? And you said, look, our window of accommodation is so big, and over time it gets smaller and smaller and smaller. And I think in my case, that's what happened. I finally just hit this tipping point between my atlas and my jaw and my bite. And I mean, I still feel myself relaxing. Like, I still feel this whole region of my face and neck and shoulders just still unwinding. I think it's going to be, I think I still have some ways to go in some sense. I wouldn't be surprised if my bite continues to shift as I get my, as everything starts to relax and get back to where it was. And it doesn't happen overnight. I mean, that's one thing I do want to make clear in case anybody watches this, is that, even after seeing you the first time and getting some relief, I feel like I got a little greedy for relief. Like, I wanted to be back the way I was. I wanted
Everybody
to
wants
be.
that, yeah.
I wanted to be back to where I was. I was trouble free, and I didn't have this sort of little bit of a black cloud over me. Like, I still have to deal with noises in my ear, or I still get a little dizzy, or I still get a little lightheaded, or whatever. But I think I've come a long way emotionally, even accepting that maybe this is as good as it gets. It's still so much better than where I was. And it does take time. I mean, I remember I was in sort of a bad place, and I was telling my husband, what if it never gets better or whatever. And he has always been so positive, saying, it's going to be fine, but it might take 3 years. And I remember thinking, 3 years? I don't want to wait 3 years. On the other hand, after 1 year, I'm in a much better place. And I didn't know what my future held. I kind of came here, fingers crossed, optimistic, hoping. But, if anybody else needs the courage to just try it, I was in that same place. I was where they were. I was scared. I was depressed for sure. I mean, I've never been a person who really experienced depression before, and I thought to myself, oh, so this is depression. Super.
Right.
This is so great. Loving it.
But isn't it interesting too how that when chronic pain is, and tell me if you've experienced this, because I've read about it and I've seen it in other patients, but they've actually done, and I forget the citation, I'll have to go back and look it up because I know somebody's going to call me on it. Where they looked at chronic pain patients and their brain scans are very similar to post-traumatic stress disorder patients. Mm-hmm. And as soon as the chronic pain is gone, the brain scans change again over a period of about 4 to 6 months. And so people, and the ladies in the office will say, oh my God, that's a completely different person than who walked in here 4 months ago or 6 months ago or a year ago. Mm-hmm. And like, they were engaging and they were asking me about my day, and it wasn't that they were coming in kind of like a sour grump. And I'm like, you guys don't understand the mechanism of pain. These patients have been suffering for months, years, decades, and they're coming in here with a very high degree of skepticism, thinking, okay, can he do what these videos proclaim he can, or it's just going to be another thing that I can try. And so the office doesn't have 100% success rate. It's between 92 and 94, but it's because, one, I don't like to lose, and number two, some of you guys, and you're experiencing relief from your symptoms now, and if you had flown somewhere, seen somebody over a weekend and flown back to Eugene, that you would have gotten some relief, but not like you have now, because I'm still following your case.
Right.
And so here we are a year into it, and you live in Seattle, and you're like, hey, this thing's off, I want to come see you. And we do, and as soon as I adjust 2 teeth in like 4 minutes, you're like, oh yeah, I can feel it's back where it needs to be.
Well, and I can just feel this is relaxing still. Like I have this sort of tingling, and I mean, I'm starting to get to, you know, it's like, I'm starting to understand what am I trying to say? This is going to sound strange, but, you know, I know that something's off when I'm not getting the same gradual sort of improvement. And when I mean gradual, it's more like, it's not a straight line, you know, it's more like an up and then a dip, and then, you know, it's sort of a jagged line heading down,
Right.
you know, toward better. It's like a stock market,
Yeah.
that sort of thing. But, you know, the feelings I can feel in my nose, like right now, sort of this nasal cavity here feels open, like there's not, something has just relaxed from here to here. And when I swallow, I don't hear a clicking noise. And I didn't always hear a clicking noise, but I could tell, like, over time that was diminishing, you know. And then I reached sort of a plateau. And I see my chiropractor once a week. He still is adjusting. Like, it's still not stable back there. That's how long it's taking. And he actually predicted it takes about a month for every year that your atlas has been out of whack. Well, in my case, that's 40 years. That's 3 years, in other words. So now I sort of understand also that healing does take time. Like it's a long, my body's been like this for a long time, and it's going to have to unwind at its own pace. But, you know, the more I get into this and the longer I'm on this sort of path, the more I begin to trust it, too. So that's the other thing. Like I'm not going to say that I trusted it 100%, even after I saw you and had these, you know, wonderful improvements, because it's scary, you know, and I, you know, I told you before, I don't really like to look at a year ago, because it conjures up these really negative emotions, you know, it's like, I don't want to go back there, I want to go forward. But, I don't understand the reluctance to just come and see. I mean, if my jaw hadn't been off, you wouldn't have done anything, am I right?
Right.
I mean, my first appointment with you was just, do I have it? Do I have issues? Can you help me even with those issues?
Right.
And I don't understand the reluctance to look at that information and decide.
Well, it's going to be one of those things that, you know, some will, some won't.
Yeah.
So you have to move on, kind of a thing.
I guess.
mean, as a treating physician, and I've always been one, because I come under fire for my treatment modality. Well, this isn't something that I just started. You know, I've been staring at the face of this animal for a decade, and most people, most dentists and other doctors don't want to treat chronic pain patients. One, because there's no way to measure what a patient says. Are you drug seeking? You know, I can't see what this thing is. And the other thing is since I can't see it, or I can't somehow manifest what's going on with you, you must be crazy and you need psychological counseling. So there's a whole group of my profession that thinks this whole thing is a biopsychosocial thing, and there's really nothing organic. And I come under fire from these guys constantly that I shouldn't be adjusting occlusion. And so I even show them a take scan of, you know, 40% is on one tooth, and I ask, you know, is this acceptable? And they're like, I wouldn't do anything unless the patient asked me. And I'm like, you're not worried about a tooth breaking, or, you know, needing a root canal or needing a crown, or wouldn't you want to know that information before you started doing dentistry on this patient?
Right.
And respectfully, no, I would still not do anything. And it's like, well, you don't even understand the disease process that I understand. And these guys are publishing. There's very definitely an agenda that all of these gadgets that I have are nothing more than gadgets and don't really do anything. And while it's true that there's a certain level of improvement, even if you do nothing over time, it's only because the body accommodates to whatever you throw at it, as opposed to, like, okay, let's try and fix something.
Mm-hmm.
So you could have easily been fixed with a very nice acrylic night guard or an orthotic that had been dialed in properly.
Mm-hmm.
The only problem with that is as soon as you take it out, you go back to where you were.
Mm-hmm.
And so you oscillate back and forth between a pathologic and a physiologic position with these. And so is the dog going to get a hold of it? It's going to wear out eventually.
I know.
You
That's
can lose
I
it,
read.
you can drop it on the hard bathroom tile, and then it breaks in half, and then what?
Mm-hmm.
Because now you're staring back into the black hole, and even though you don't feel any different, you know it's coming. And so, okay, holy crap, I got to call him, and we got to start another one at a cost of thousands of dollars for
Right.
this piece of plastic. Well, okay, now I'm to the point where I haven't made any of these for 2 years, and I'm in the low to mid 90s in a success rate. Is that acceptable to a patient, or even to another doctor on another procedure? That like, okay, well, I know that the Meniere surgeries aren't 90%. They're at 50% best.
Maybe.
Maybe as far as what I'm gleaning.
Right.
Not always from patients who had successes, but patients who've had, I've had that surgery, or I've had this done, and I'm still having the problem now. And it's like, okay, well, clearly you were misdiagnosed, and
Right.
let's take a look.
Right.
Oh, yeah, by the way, the affected side is the side that your bite is off.
Right.
Let's just
Right.
go down this path a little bit.
Right.
And, the patients don't need to be convinced of what they see when
Right.
they see on the tech scan. They're like, okay, somebody's finally given me at least an
I
explanation
know, yeah.
for what's going on, and then piecemealing this together, and they say, well, this makes sense, and how come you're the only guy doing this, and how come my dentist doesn't know what you know, and how come my doctors don't know what you know? And it's like, look, I've gotten to the point where I'm beyond what anybody thinks about me. I don't care what the critics say. I listen to my patients, and my patients have taught me just as much as going to any course or any guru can, because I'm still learning. I had a patient who came in today with the globus with the neck thing.
I don't know what that is. Okay.
You had it. Like a hand is just resting on your neck.
Oh my gosh,
That
yeah.
thing?
Oh,
Okay.
yeah, I know what you're
Yeah.
talking. Yeah.
So-
Oh my God, I forgot about that.
We have a short memory for things that don't affect us anymore.
I know.
So,
Yeah, that's sort of-
her dentist, who
Yeah.
is up in Salem, had been to one of the courses and said, this is so odd, and I've heard this before, you need to go see him in Eugene. So she comes down, and she's a surgeon's wife, so they have it all as far as an access to care.
Oh,
Some
absolutely.
very good
Right.
people.
Right.
They were about ready to do surgery, I think, if I remember correctly. And so I saw her today, and we did our thing, and she's like, yeah, it's not here, it's here. So it's moved,
Yeah.
and we can see, again, like you just pointed out, the muscles have changed in the course of 20 minutes, and I didn't do anything but just set the bite where it should be.
Right.
And so she walked out of here very happily.
Yeah.
But I mean, it could have been just as easy as something that took, 3 months or 6 months or a year to fully resolve. And so, while we're still kind of doing that case, but it's, you never know what you're going to get until you do it. But I would have never, ever thought that, and it's not on any symptoms chart that I can find, this
You're right.
hand around
Yeah.
the neck thing
Yeah, that
that's constantly there.
constricting feeling that, that, I forgot.
And it's only women
Oh,
that
nice.
complain of that, because she's
That's
like the
funny.
7th one. Now, since the first one 2 years ago mentioned it, it's like, okay, I wasn't even asking that as a question. So chances are I've treated patients
You're right.
and it's either gotten better or stayed the same or whatever, but I've been ignorant of that data.
Well, and that's the other thing too. I mean, I think when I first started looking at your videos, and I think I mentioned this too, I didn't have, nobody's case matched mine exactly, but I thought, oh, I've had that, like of that one person who would talk about something. I mean, the woman who ran and she would get this pain, and I think it was her neck or her shoulder. Okay, that would happen to me. You don't think it's anything. You know, you kind of go through life thinking, oh, well, if it goes away, I guess it's nothing. You know what I mean? But it never dawned on me that that symptom was a symptom of something. And, you know, so while this thing sort of came to a head last summer and into the fall, I've been experiencing a smattering of all of those symptoms forever. Migraines, a little bit of lightheadedness, pain in here, tenderness here, teeth sensitivity now and then, nothing chronic and no pain, like as I said, like
right.
no pain, just, I don't know. So even that is eye-opening to me because I think to myself, wow, who knew, you know, and it also kind of, I don't think people I don't know how people would ever be able to connect all the dots either. I mean, if I hadn't happened upon you, I wouldn't have connected those dots. I'd still be just wandering around. You know, if I just put 100% of my trust in my ENT and just thought, well, this is what I have, and not thought to myself, this doesn't, I mean, maybe that is what I have. But I'll accept that diagnosis when I've exhausted having the possibility because
Sure.
I've got too much to lose here. It was horrible. You know, it was horrible.
Well, I appreciate you, again, coming back and allowing me to shoot a one-year post-op
sure.
video. And I'm glad you're doing great.
Yeah, thanks.
And,
I mean, I don't know. I don't know why people don't want to listen. I don't know why people are so reluctant to just say, let's try it. Doctors, I mean, why not? I mean, I actually sort of think one day I'm going to have the strength to go back to my ENT and say, okay, so this is where I am now, and let me tell you what happened. And I mean, he'll either share it with people or he won't, but I don't know.
Well, I'll tell you what my experience has been on that. So, I mentioned to you about my friend who had the migraines for 20 years.
Yeah.
She is, she's doing better.
Yeah.
She's like, okay, look, it's been a couple of years since I've had a checkup.
Uh-huh.
I'm gonna go in and have a checkup.
Yeah.
She was not going back to any of the other doctors that she went to that thought she was crazy, even though she's pain-free.
Mhm.
So she goes in and sees a new doctor.
Mhm.
And again, for a routine,
Mhm.
just a history and physical and a yearly checkup. And have you ever suffered from?
Mhm.
And that list comes out, and she
Mhm.
goes, oh yeah, but I saw Dr. Sutter, and he adjusted my bite, and now I don't have migraines or headaches anymore. And the doctor said to her, there's no way a dentist could have helped you with that. And so I said, well, what did you do at that point? And she said, I picked up all my stuff and left, because that person
Right.
is not open enough
Right.
to really be treating
Mhm.
me
Mhm.
as a patient.
Yeah.
So, and not that I got a professional phone call like, okay, dude, a crazy came in that you treated, and I need to know, what are you selling over there, because this doesn't add up in my knowledge base of what I know. No phone call, no nothing. Like, hey, why don't you come over and just spend an afternoon and watch me treat these patients and see what I'm doing, and let's connect the dots.
You know, and it's not that hard to find on the internet. I mean, when you're diagnosed with something like this, you just I became like a dog with a bone. Okay, and it's not that hard to find studies, you know, that are published. I mean, it's not that hard to come across information where people are treated for TMD symptoms, and the symptoms that I have are relieved or lessened.
Sure.
You know, in both the upper cervical issue and TMD, it's not like you can't find some NCIS study or something where they've treated 10 patients, and I know that that's not proof either. I know that that's not what people who want proof are looking for, but it's anecdotal.
Yeah.
It's certainly enough to say, that's kind of interesting, and I don't know. I don't know.
And even if you found 5 studies with only 10 patients in
Right.
them, and you found no studies that said, hey, we tried to repeat this and we didn't get the same results, because there's plenty of those out there,
Right.
especially in academia
Right.
and other scientific and physics and cell molecular biology and stuff where, oh yeah, this 2-component signal transduction does not really work like that. And I've spent enough time in undergrad and doing research where in some years I got published, in some years, or at Columbia, I never got published. And so you know the people who publish, and you can't, nobody can repeat their experiments. And it's like, look, this should be repeatable. And so, for guys in 6-month time to start posting their own videos of, hey doc, this is how what you taught me is helping me help my patients, kind of a thing. Like, okay, well now, if I just get a couple of doctors that believe in what we're teaching, and in themselves, are like, look, you could do this, it can be taught. And so now you've positively not only impacted that doctor, but every single patient that walks through the door
Right.
with these problems. Because the 3 guys who are really kind of at the forefront of this, we can't treat everybody.
Right.
I can't even treat, if everybody in my practice who's suffering from things that you're suffering from or we're suffering from, if they were just to stand up and hand me their credit card and say, I'm ready to start tomorrow, I couldn't treat them all. It's 25 to 30% of the U.S. population. It's huge. And so, nor do we want to treat them all.
Right.
So,
Right.
we gotta have a family, and we gotta have vacations.
Right, exactly.
We can't burn out.
Right.
So, all of us are just trying to, like, anybody who wants to take the course, come join us and see what, digital measured occlusion really is, and know that there is a whole organism on the other half of that tooth, of that filling that you just put in,
Right.
or the tooth you just extracted,
Right.
or
Yeah.
whatever the case
Yeah,
may be.
it doesn't just stop here.
Yeah.
It's not just
No.
this little, it's not just this little area.
Promete